Hello, everyone, and welcome back from your lunch break. We hope that you ate a delicious snack and that you're ready for our next presentation. So, our next speaker is Miss Melanie Martin. Melanie graduated with her BA in biology and minor in psychology from Arcadia University in 2015 and obtained her MS in neuroscience from Drexel University in 2017. Currently, she is in the accelerated Bachelor of Science in Nursing program at the University of Pennsylvania. Melanie is submatriculated into the Master of Science in Nursing program, concentrating in primary care of older adults. Her ultimate goal is to work outpatient as a neurology nurse practitioner. Please welcome Miss Melanie Martin as she discusses the topic From Bench to Bedside, the road to nursing. Thank you, Melanie. You can start sharing your screen now if you would like.
Great, thank you so much. I'm going to go ahead and share this. All right, let me know if you can see the presentation okay. Can you see it?
Okay, yes, we can see it.
All right, perfect.
If you would like, you can put it in present mode. Yes, perfect.
Okay. Great. So, all right, so today I'm going to talk to you first a little bit about my journey to nursing. So first off, to introduce myself, again, I'm Melanie Martin. I'm a current accelerated BSN student at Penn Nursing. And today I'm going to talk a little bit about what led me to nursing. I'll talk a little bit about the application process for nursing school in general, and then specific to Penn, as well as a little bit about the curriculum. And then I'll also be giving some words of advice for those of you who are interested in pursuing a career in nursing. So first off, I wanted to kind of pose this question. What do you want to do when you grow up? It's a question that I think frequently gets asked at different stages of our career path. And I think we're kind of expected to be able to have a good answer to that question when we're in high school, in college, and some people, take longer to arrive at an answer to that question. So when I was thinking about this question, when I was graduating from high school, I thought my path would look a lot like this. So this path is, winding and long, but overall pretty straightforward. And there's not a lot of bumps or, roadblocks in my way. But in reality, my path looked a lot like this. So it was very winding, sort of more like a maze than a linear path. And I think if there was one thing that I wish someone had told me before kind of like embarking along my education and my career, would be that it's completely okay if your path is not a straight line. In fact, I think it's almost better if you kind of make mistakes and figure out what you want to do along the way, because I think it kind of helps you grow as a person. So just a little bit about me and my background. As it was said previously, I graduated from Arcadia University, which is a small liberal arts college in Glenside, Pennsylvania, in 2015. I got my bachelor's in biology, my minor in psych, and I felt really lucky to be able to go to a school where it was a small classroom, sort of a small hands-on experience, if you will, where I could work with professors close on in research. And it was kind of there where I realized that I did have a passion for doing research. I got to work with lots of different professors. And so ultimately, it kind of led me to the path of wanting to pursue my PhD. And in hindsight, I think I had this preconceived notion of what a PhD would be based on my interest in my classes, based on my coursework, based on research I had been doing at Arcadia. I felt like that was the best fit path for me. And so I shadowed in different labs. I ended up applying to different PhD programs. I want to say I applied to maybe 10 programs. And I ended up accepting a spot at Drexel University College of Medicine, which is below. And that's in East Falls, so right outside of Philadelphia. And from there, I kind of knew pretty early on into my program that it wasn't a great fit for me. But I wanted to stick it out and kind of see if anything had changed. I rotated through a couple labs, and I quickly realized that doing bench side research, working with rodents, rats, mice, was not really a great fit for me. Um, and so ultimately, I ended up making the switch about a year in to switch to getting my master's in neuroscience in 2017. And I think through that experience, it was good because I still love research. I still want to incorporate research into my career. But I realized that I needed to be closer to working with humans and working in more clinically relevant research, even though I still do have a great appreciation for basic science. There's aspects of it that I miss a lot. I like doing cell culture. Sometimes I miss the rats, but not so much. So ultimately, after I graduated, I ended up applying to positions. I did a couple different things. I taught neuroscience to middle schoolers. I ended up volunteering at Moss Rehab in Philadelphia, working with people who have aphasia and also working on behind the scenes research there. And then I applied to probably over 50 positions, mostly at Penn, because I was really committed and had my eyes set on getting a job at Penn. I kind of knew that that would be the best place to do clinical research to get the experience that I really wanted. And actually, going into this, I thought I would be pursuing another PhD, maybe in clinical psychology. I thought, okay, maybe I'll go more of like the clinical route, and that would be a better fit for me than basic science. And so that led me to working. If you look at the picture on the right, that's Richard's building on Penn's campus, and that's where my office was. So I accepted a job at the Penn FTD Center. And for the last almost 3 years, I was working as a MRI research specialist. And I worked in the neurology department running a functional MRI study where I would recruit patients from a neurology clinic. I would schedule their research visits. They'd be doing MRIs, but also cognitive testing and various other blood draws, things like that for research consortia studies. And I really loved what I loved most about working there was my interaction with patients. It was the direct clinical interaction that I loved, especially after working there for almost 3 years. My study was longitudinal. So I would have the same patients come back year after year. And it was nice to kind of develop rapport with the patients, but also with the caregivers, because it's in my role was kind of limited. I had limited interaction with them doing research. I wasn't really with them clinically, but I was able to still develop relationships with them. And it was at that point that I started to think, okay, maybe the PhD is not a good fit, and maybe clinical psychology is not a good fit, but maybe I want to do something even more clinical and kind of move away a little bit more from research, but not completely away from it. And so that ultimately led me to pursuing a career in nursing, because I did really want that direct patient interaction. I also consider myself a very empathetic person, and I feel like nursing is a good fit for that. And I did not even realize prior to working at Penn that nursing provides so many opportunities to also do clinical research. It's not just the direct patient interaction. So I thought that was a great fit. And that's kind of what led me to my current position as a student. So I wanted to give some broad pieces of advice before I talk about the specific application process. But things to think about, and these things are going to sound extremely cliche, but I feel like they're still really important to at least touch on. Talking to people in the field. So this can apply to not just nursing, but any pre-health field that you're interested in. I think it is so critical to talk to people who are in the job role that you're interested in, even if you're not sure. I say that because I felt like, in hindsight, I have no regrets about leaving a PhD program. It was probably one of the hardest decisions I ever made in my life, but I don't look back on it with any regret because it led me to where I am now. And I think had I talked to more people in the field, maybe had I had a better understanding of the day-to-day tasks that the job would entail, I might have reconsidered a different career path. And so through working at Penn, I was able to talk to a nurse practitioner and talk to people in the field, and kind of get a better idea of like what I'm actually going into and what I'm signing up for. And that kind of piggybacks off of the next point of find mentors. I think when people say find mentors, you feel like it has to be, I don't know, you have to like find this perfect person through networking or something like that. When in reality, it could be someone that's right in front of you. It can be a professor, it can be your boss, but just find somebody to kind of talk to who has more life experience than you and can help point you in the right direction along your career trajectory. Asking honest questions, I think, is another thing that needs to be emphasized more, even though it seems quite simple, but something I wish I had done through the PhD process, through interviewing at different PhD programs, was asking questions that were like not the easiest questions to ask. So things like salary, things like advancement in your job and in your career. What does this job look like? Is it a 9 to 5? Do I have to work weekends? One of the questions I had asked was actually about something kind of random, but about like medical malpractice as a nurse practitioner, and what does that look like in comparison to a physician? And those are the kind of questions where I was like, oh, I don't know if I want to ask this question, but I feel like those are things I need to have the answers and have the knowledge before I'm pursuing a career for the rest of my life. And then lastly, shadowing. I have shadowed, rotated in probably, I don't know, maybe 10 labs throughout my education, my career. And each one has had an important role in leading me down the path of nursing. But again, I think if you want to go into nursing, you should shadow a nurse or shadow a nurse practitioner or shadow whatever specific concentration you want to go into, because that really is the only way for sure that you're going to know if this is a good fit for you. And you're going to see things on a daily basis that you might not have thought of if you're just, researching things on Google. And then the question always comes up, why nursing? And that's a question that I had to ask myself many times. Given my educational experience, my background, I was very apprehensive to go down a new career path because I was afraid of making, another mistake, even though I don't view anything in my past as a mistake, but I was nervous and I wanted to really be sure that this was the right path for me. And so when I was thinking about pursuing nursing in terms of other career paths that are in healthcare, I thought about the direct patient interaction, which obviously you can get from being a physician. You can get that from being a PA, physical therapist. There's lots of ways to get direct patient interaction that isn't nursing. But I think that with nursing, I think what drew me to it was also more of like the empathetic side of nursing, that you get to kind of talk to the patient about their day and kind of get to know them on a different level than any of those other career paths. The flexibility of nursing is something that I was not well versed in prior to starting school or starting this like career path. There are so many different avenues. I think when you think of a nurse, you typically think of somebody who's inpatient working in a hospital, and it's so much more than that. I want to go into outpatient nursing, but there's legal nursing, which I didn't know was a thing. I have a couple other career paths on the next slide, I think, but there's just so many different fields that you can go into. A school nurse, things that you don't like typically think of, as well as the ability to do clinical research, which is something that I kind of thought, okay, am I saying goodbye to research by pursuing a career in nursing? And what I didn't realize is that I definitely can still have my cake and eat it too, so to speak. There's still a wide array of options in clinical research with nursing. You can pursue a PhD in nursing and focus on more research-oriented nursing if that's what you're interested in. You can have thesis projects. You can work with faculty who have grants, who are doing research. And so that was something that drew me to Penn, because they are so well known for their clinical research and for nursing as well. And then the job outlook of nursing, as you can see now with the pandemic, I feel like nurses are in high demand, and I don't see that stopping anytime soon. I think the job outlook is good as far as you can definitely climb the ladder, so to speak. So you can pursue, becoming a nurse practitioner or getting your doctorate in nursing. And so I don't think there's any shortage of nursing jobs. If anything, I think the coronavirus pandemic has given people a greater respect and a greater appreciation for healthcare workers, and especially nurses who are sort of at the front lines, as we can see. And that kind of brings me into my next point of that nursing is meaningful work. I think that you have to have a certain personality to go into the field. I think you have to be empathetic. I think you have to care for people in a way that I feel like is very unique to nursing, because you're going to deal with the monotony of things on a day-to-day basis. You're going to deal with birth. You're going to deal with death, and I think you have to kind of know what you're getting into before you go down this path, and making sure that that kind of fits your personality. And then leadership roles and opportunities. Again, that kind of goes off of what I said before, but climbing the ladder, I think there's lots of opportunities to be, a nurse manager, to go into other fields of nursing that you might not particularly think of as just the direct patient interaction, but you can also teach in nursing in the nursing school. So I think there's opportunities to kind of demonstrate leadership skills within the field. And this is the slide that I was just referencing before, but the possibilities really are endless as far as career paths. So, you can be a critical care nurse. We actually recently, in one of my classes at Penn, had a nursing informaticist come in and speak to us, which I had never heard of before. And basically her background was more technology based, more computer science, I guess you would say. And she worked on hospital record systems, trying to come up with better ways for doctors and nurses to use electronic medical records. For example, if somebody had an allergy, what's the best way to display that in a patient's chart? What's the best way to navigate through a patient's chart that's quick and easy and efficient for healthcare workers? And so she was sort of the person behind the scenes, but her background was a bedside nurse. So I think the interesting thing also coming into nursing as my second degree, so I'm not a traditional bachelor's student, it's my second bachelor's degree. I think everybody's coming into it with a different background. A lot of people came into it with a more science-focused background. Some people came into it with an English background, and then this is their second career as a nurse. And so recognizing that everybody is unique and brings something different to the table, I think is what makes the field so interesting. And so you can see the other career options on here too, but like legal nursing, midwife, nurse manager, nurse practitioner, nurse anesthetist is a really popular field now to go into, with another good job outlook. Travel nursing is an option. So I just put this slide up here to show you that it's more than just what you traditionally think of as a bedside nurse. Okay. So I just want to talk about the application process a little bit. So I really can speak more specifically to Penn. I can't speak for all nursing applications, but traditionally you're going to have some type of essay to write that's specific to the school that you're applying to. So you're going to have supplementary questions, and I can almost guarantee you one of the questions is going to be why this particular school. So why do you want to apply to Penn? Why do you want to apply to Jefferson, Drexel, wherever it is you're applying? And I think doing your research there is really important. So what makes that school unique? Is it their research? Is it reputation? Is it faculty? I don't know. Are they really good at preparing you for the NCLEX? Things like that are important to look into. Is it accredited? And then they're definitely going to ask you a question which sort of goes into your personal statement of why nursing. I think you have a unique answer to that question, not just the same old that everyone's going to say, but kind of sell yourself in your personal statement. Talk about your education, your career interests and goals, your healthcare experience. Even if you don't have healthcare experience, that's completely fine. I talk about in the next point, highlighting your volunteering experience. So kind of, any direct people interaction, even if it's not patients. So if you're, what's the word, EMS or something like that, if you do volunteering at a hospital, just something like that to put on your resume, definitely, can't hurt. And then your transcripts, you're going to have to send from all your schools, which is pretty typical. It's not unique to nursing school. The GPA threshold, I believe for me was greater than 3.0. The great thing is sometimes the GREs can be waived. So again, I can only speak for bachelor's as a second degree, but if you have your master's already and your GPA is greater than 3.0, or if your bachelor's GPA is greater than 3.2, they completely waive the GREs, which as somebody who's taken the GREs a couple times, I did not want to have to take them again. So that was really great news for me. Personal statement I already touched on. Letters of recommendation, I feel like are, okay, so important. So a lot of times there's so much emphasis being put on standardized test scores and your GPA. I would argue that letters of recommendation, I think, weigh more heavily than your GPA, because that's really the opportunity for someone to read about who you are as a person, how you're going to be as a student, as a future employee. And so I think having really good letters of recommendation can sometimes counteract a not super high GPA. I wouldn't worry about that or let it deter you completely, because if you have really good letters of recommendation, they go a really long way. Make sure they're not personal letters of recommendation, that they're professional or academic ones. I believe Penn required 3, but again, I feel like you should check on individual schools and their requirements before you are applying. And then this was new to Penn this year, but they actually had a video interview, and this was pre-COVID, which is kind of funny because now everything is being done virtually. But the video interview was kind of tricky. I've never done that before. So they have pre-asked questions that you have to answer. And what I did is I ended up kind of writing myself a script out on the computer, practicing it, recording myself to make sure my time was within the time limit. And then you only get 2 tries to record your video interview, and then that's it. You're done. So you really want to make sure that you're well prepared for the interview going into it, and that you've completely answered the questions before you submit your application, because once it's submitted, you can't go back. And then another one of my interviews was in person, and that was actually a group interview, which I've also never done before. But I think it was kind of interesting because it gives you an opportunity to, again, sell yourself. I think sometimes that can be uncomfortable to people because you feel like you're being self-centered, or I don't want to just talk about me all the time. But I do think that that's kind of your opportunity to set yourself apart from the other people in the interview. It's also really important to make sure that you have questions for the person interviewing you. So of course, they're going to be asking you questions, but also make sure that you have a couple questions in your back pocket. Tell me what research is like here. Like, what does your research look like at this school? Tell me why I should come here. Like, what do you think's unique about your school? I mean, you're allowed to interview them too. It's not a one-sided thing. So that would be some of my recommendations for the application process. As far as the application timeline goes, the application for Penn, again, this is specific to Penn, this might be different. The application opened in July. The deadline was around October 15th. It's not rolling, so don't worry about rolling admissions. The interviews were in, I want to say, around January, and I was notified the first or second week in February that I was accepted. And then my program just began this last June virtually. So again, as far as nursing specifically at Penn, so I am in the 18-month accelerated BSN program, but there also are other nursing programs at Penn. You can do a BSN to PhD program, which I believe is called the Hillman Scholar Program. There's a lot of different bridge programs like BSN to MSN, which is what I'm doing, where I'm submatriculated into the master's program within a specific concentration to become a nurse practitioner. So that's something that you can actually apply to when you're applying for the BSN program, or you can just apply to the ABSN. And if you decide later that you think you want to become a nurse practitioner, you can take coursework and submatriculate. You can apply to submatriculate into the master's program. On the left there, you can see the different nurse practitioner programs that are available at Penn. So I am in the primary care adult gero program, but there's also acute care, family, neonatal, psychiatric, women's health, I missed pediatric. There's also a midwife program, as well as different healthcare administration programs, certificates, minors that you can do in addition to your degree. I have up there that submatriculating to the master's, if you go full time after the BSN, it's roughly a year. That's not always the case. That's for my program. Some are a year and a half. Also, if you choose to go part-time, getting credits for your master's, you can also work as an RN, and it would roughly take me about a year and a half to get the MSN while I was working. And then there's various minors. I won't read all of them, but there's for the traditional bachelor's, these are the minors on the left that you can get. Global health, I think, is in both. Nutrition's in both. For your master's, there's a lot more options, but these are other minors that you can get in addition to your MSN degree. And then as far as prerequisites go for the coursework, so prior to even applying, I kind of looked into what types of classes I needed to have in order to get accepted into one of these programs. And coming from a science background, I luckily had a lot of the coursework already, but I also, surprisingly, with my BA, did not have a lot of the coursework. And so I already had general chemistry and biology, but I did have to take 8 credits of anatomy and physiology with a lab. I actually took mine online, again, pre-COVID, which is ironic, and the lab was accepted. So an online lab is completely fine. I took 4 credits of microbiology with a lab, and then nutrition and statistics. Statistics I also already had taken in college. My warning to people applying is to make sure that you check the criteria for the prerequisite classes, because some places want to see you have your coursework within 5 years, and some people want to see you have it within 10 years. So 10 years was the case for Penn, but other places would actually make you like retake general chemistry or retake biology, even if your bachelor's is in biology. I would talk to the specific school about that, but just being aware of those specific requirements, because at that point it had almost been, I guess, 5 years or so since I'd been out of college, and I didn't want to have to retake all of those courses I'd already taken. And then as far as the curriculum for Penn, again, I'm just going to give you some of my personal experience. I can't speak to every nursing program, but for summer of 2020, things were a little bit different for me because my program was virtual. But I took pharmacology and physiology. I took something called Pathways to Practice, which is essentially like a nursing 101. And then I took physical assessment. And physical assessment, we actually just this week, I was completing the in-person component of that, where we do a head-to-toe physical exam on our partners in full PPE. And so most of the stuff was online, but some stuff, obviously, for nursing, you really just cannot do it virtually. So pretty much the way they built the program was to do all of the didactic material before we were able to do the in-person session this week. And then the last course was Social Determinants of Health. It actually has a much longer course title than that I can't remember, but that's more of like a sociology and psychology course about nursing. And you learn a little bit about like the history of nursing and being able to talk to patients and therapeutic communication and things like that. And as far as the fall curriculum goes, again, I'm not that far into the program, so I'm not exactly able to speak fully on my experiences, but this fall, I'm going to have women's health, psych, pediatric, and I'm also taking, not really an elective, but it counts towards my master's program. It's scientific inquiry for evidence-based practice, which I'm excited for because I feel like that's very relevant to research, clinical research, how to be a good scientist and how to kind of incorporate that into your practice. And in addition to these 3 fields, women's health, psych, pediatric, there's clinical rotations where you get placed, or you can pick hopefully the site that you want in a hospital, in a clinic. It could be inpatient, outpatient. And there's also a lab component of that where we talk about more of like medical administration, dosing, things like that, like at the bedside. And then there's also a lecture component that goes with each of those. So they're roughly 4-week rotations. So I'll be doing women's health first, then I'll move to psych, and then I'll move to pediatric after that. So it sounds like a lot, but the way they kind of design it is that you're rotating through different fields to get exposed to different areas that you might be interested in. And then, as I mentioned before, there's some coursework built into the BSN that doubly counts towards your master's, which is really nice because if you already know that you want to go on for the master's, you might as well get some credits racked up towards that so that hopefully you finish faster. And then other courses for the bachelor's that aren't necessarily like clinical rotations, there's healthcare ethics, healthcare in an aging society, and these are specific to my primary care for older adults. But if you were going into pediatrics, your coursework might look a little bit different. There's community nursing, case studies, which is really cool because you can find something that you're interested in and apply to a specific case study. I think there's like an oncology case study. I'm trying to think what else. There might be like an older adults case study, and then advanced physiology and pathophysiology. And then for my MSN specifically for adult gero primary care, again, these are more tailored to what you're interested in, but primary care of middle and older aged adults, professional role issues for nurse practitioners. So I'm very excited for these classes because it's geared to what I'm particularly interested in and the field that I want to go into. But yeah, the other thing too that I want to mention about curriculum is that so I've always been interested in the brain. I love neurology, but there's no like specific neurology track within my program. And so the cool thing is that if you're able to, you can find a clinical rotation that's specific to your interests. So for me, for pediatric, I'm doing a neurology rotation at CHOP. And I'm excited about that because I was able to get placed somewhere that's more specific to my interests. So there's ways to find coursework and clinical experience that is geared towards what you're interested in. And then some words of advice. So again, these are going to be really cliche, but I do mean them. I do mean them. So you are you. And while it may be intimidating working with people who seem smarter than you, more experienced than you, there is something unique to you that you bring to the table. And so I think that you really need to highlight your strengths. There are plenty of people in my program who have had no clinical experience. They've had no science experience. This is a completely new career path for them. But they bring something unique to the table that I don't bring to the table. And so I think kind of practicing highlighting your strengths and kind of practice selling yourself is an important skill to have. Don't be afraid to ask questions. I think through things being virtual, I've had to kind of be a little bit more proactive in asking questions because I was not in a traditional classroom setting. I couldn't just, raise my hand and ask my teacher a question. And similarly to what I was saying before about asking honest questions, I think, when you're observing and shadowing things, ask as many questions as possible because that's really the only way that you're going to learn. Networking, I think, is so important. When I thought of networking in college, I thought networking was sort of like, okay, I have to make a LinkedIn profile and I have to, add connections on LinkedIn and find all these like, top nurse practitioners or top researchers or whatever. And that's like the only way to properly network, which obviously is not true. So by networking, I mean that there's been so many times in my career in education that I've connected with somebody who was a friend of a friend or a professor's daughter or spouse or whoever it is, sibling. So you just have no idea. The point I'm making is you have no idea how someone can be helpful to you, who they might know and what connections they have and who they can put you in touch with. So I think networking is more about looking at the people that are already within your circle and trying to say, hey, do you know anybody who's in nursing? Somebody's daughter might be in nursing or they're pursuing a degree in as a nurse practitioner. And then I can talk to them about the field and tell me like, what was it like with the application process? Do you like your job? I think that's a really important question. Like that's not asked enough is, do you like what you're doing? And also when you're interviewing at schools, ask the current students, do you like where you go to school? Do you like this program? I interviewed at a PhD program once where the students were just like absolutely miserable. They did not seem happy to be there. And I was like, well, I don't want to come here if you guys don't seem happy. You're not selling the school at all. So I think just, talking to people is really like, I just cannot emphasize how important that is. Be open to new things. One of the things that they tell us in my program is that you might go into the nursing program with a specific career trajectory in mind, like I do, and I like neurology, but I'm also trying to be open to the fact that there might be a different field of medicine that I'm more interested in, along the way. And so I think trying to not close yourself off so much to just, one thing, and being a little bit more open-minded at, maybe there's something else I might like even more somewhere down the road. And then putting aside preconceived notions. I touched on this a little bit too, but I think I had a very preconceived idea of what nursing was and what it meant to be a nurse prior to applying to nursing school. I think it's very hard sometimes. I think that you get a lot of input from other people about what they think. So as important as it is to talk to other people, I'll also double back on what I said is it's important to not get too many opinions about your career path, because ultimately it's your decision what you want to go into. It's nobody else's choice. Regardless of what you choose, someone's going to have something to say about it, negative or positive. And so I think, a lot of times people are going to say, why didn't you want to become a doctor? Why didn't you want to, why do you want to stay in research? Why did you leave your PhD? There's always going to be people that are going to say things. And I've had to learn to kind of put aside those comments, because ultimately it's my decision and my career path. And also same thing with research, putting preconceived notions aside of, a lot of people think researchers just sit at a bench and they don't talk to people and they're quiet and they just don't communicate. They work alone in a tiny little desk and that's it. That's their career, which could not be further from the truth. And same thing with nursing. I think people just think, okay, well, you work in a hospital and you help the doctor. I mean, that's it, right? So I think putting those things aside is going to help you kind of look at your career with fresh pair of eyes, without those outside influences coming in. And then learning from your mistakes. So I feel like, you can look at your past career, your past educational experiences as mistakes. But I guess it's kind of bad word to call them. I think that, they're learning opportunities. So at every stage of my life, there's been a learning opportunity. And I think that helps us grow as people. It helps us figure out what we want to do and get to where we need to go in the future. And then lastly, do what makes you happy. So I think, it's cliche to say that, but ultimately I was not happy in a PhD program. And I had a lot of people telling me that you had to stick it out because you've worked so hard to get here, just stick it out. And once you get on the other side, you're going to have that degree. But that degree is not everything. There's more to life than just getting a degree in a field. And I think you have to really like what you're doing. I think you have to have meaningful work that gives you a reason every morning that you wake up, you go to your job, and you're excited to do your job, to do your work. And I didn't always feel that in what I was doing before. And so I think that really is first and foremost what's most important. Forget about money. Obviously, that's important. Job outlook's important, but you need to be excited about what you're doing, because I can tell you, if you're not excited about what you're doing, one day you're just going to wake up and be like, all right, like, how did I get here? I'm not happy here. I need to do something different. So that's my best advice that I can give to anybody that's pursuing any career path, not just nursing, is really try to think about what makes you happy. And then I'm just going to leave you with a quote that I found online. It says, to do what nobody else will do in a way that no one else can, in spite of all that we go through, that is to be a nurse. So I finished a little bit early, sorry, but I will now take any questions that anybody has.
All right. Thank you so much, Melanie. I really liked your presentation, and especially the point that you touched on the last slide about students doing a lot of like self-reflection on what they are actually passionate about. And that's something that we really want to emphasize in the conference. So thank you for bringing that up. And now, if you want, you can stop sharing your screen and we can do panel view so that the attendees can see both of us.
Okay.
Perfect. So yes, gallery view. And we have some questions from the audience. So I will start asking them, but anyone else who has questions, feel free to type them on the Q&A and we will try to answer them. So the first one is, may you describe what it is like taking those labs virtually? In your perspective, is it more difficult to overcome or a little less stressful? So I guess it's in the context of the pandemic, when you will be taking your classes and doing all the learning that you need to do as a nurse, is like, how is that transition gonna happen and how has it been for you doing things remotely?
Yeah, so it's definitely not what I expected. Just giving an honest answer. I mean, applying to nursing school, I obviously did not predict there being a pandemic. I will say I feel like Penn did a good job at transitioning some things online. So it was kind of weird, but we went through introducing ourselves to the patient, a lot of role playing of imagining that you were going into a room, imagining that you were going to give medication, and talking through all the steps that you would do if you were in person. Again, that's far from an ideal situation, but I was really pleasantly surprised at how well it did work, and I felt like I got a lot more out of the experience than I maybe realized in the moment. But yeah, so we did like med checks, like medicine administration, things like that, virtually as much as we could do. As far as physical assessment, we talked through, what we would be doing. Like, okay, you're gonna have the person open their mouth and say ah and things like that until we were able to get there in person to do it. But was it more difficult? I think it was also difficult in the sense of like I didn't get to meet my classmates. And everything being virtual is a little bit more awkward to communicate with people. But overall, I think like coursework wise was completely fine virtually. And now moving forward in the fall, I am going to be able to do my clinical rotations. And I just had in-person labs with all the PPE suited up, ready to go. So it was more and less stressful in different ways. If that makes sense. More stressful because I think I had to work a little bit harder at like learning the material, but certainly less stressful because I wasn't doing it in person. Less pressure on me to perform in front of other people.
All right, perfect. Thank you so much. So our next question, what would you recommend high school students to do to boost their resume during the pandemic? And I guess this is for not just high school students, but just basically anyone. What type of things can they do? And I know you mentioned like shadowing nurses and things like that. Do you know if opportunities like that are still available remotely?
That's a hard question. I'm not entirely sure. I know that some hospitals, especially with my clinical rotations, are not super keen on accepting students if they don't have to. I mean, it was like a struggle already to get me into clinical rotations. I mean, I'm not saying that all places wouldn't. There might be some places that you can volunteer at now, and I would just try to reach out to some places and see if they're taking students. I don't know, it's hard. I mean, I'd imagine there's some jobs that you can do virtually, even if it's like medical entry of data and stuff like that, just to have something to put on your resume that's somewhat related to medicine. Um, yeah, that's a tough question. I don't know. I mean, there's definitely online jobs in medicine. I mean, telehealth is also a huge thing now too, of virtual, patient visits. I don't know how shadowing would look like virtually, but I don't know. That might be something to look into is telehealth because that's a huge field that people are going into of having virtual communication with your doctor. And so there might be some type of experience that you can get like that without ever stepping foot in a hospital. But yeah, that's tough. I know it's like a very hard time right now to find work experience.
Yeah, it's pretty difficult. I'm gonna ask some questions that I have prepared, but if our students have any more questions, feel free to ask them on the Q&A.
Okay.
So my question is, what are the working hour conditions as a nurse? Or more personally, what would your ideal schedule look like when you start working?
What would my ideal schedule look like?
Yeah.
I personally would like more of a traditional 9 to 5. I mean, for inpatient, it would look very different, like long, potentially 12-hour shifts, working on the weekends, things like that. And my clinical rotation coming up actually is like a 12 and a half hour shift. I don't think I'd want to do that forever. But yeah, I would like a more typical like 9 to 5 type of job. Um, I mean, I don't necessarily mind working on the weekends. I mean, not all day, but yeah, I think that's something to definitely consider in your career path is, are you the type of person that's okay getting up super early in the morning and working super late at night? Or do you want a more regular schedule, especially if, some people going into nursing as their second career are married, they have kids. And those are things to take into consideration too of, are you able to have a family with this career path? And what does that look like as far as hours and workload on your family? Yeah.
Right. And I know you mentioned that there are different types of nurses that you could become. So, like, does your schedule vary depending on the type of nurse that you are, or do you have flexibility to kind of choose based on where you're working?
Yeah, I definitely think, again, depending on whether you want to do like inpatient or outpatient, I think your schedule is going to look very different. I think in the beginning, though, as a student, your schedule probably looks pretty crazy, regardless of what concentration you're going into. But I think, yeah, depending on going into primary care, if you're going into like women's health or OBGYN, babies get delivered at all hours of the day. And so things might be a little bit more chaotic if you're going into that line of work. Critical care, emergency medicine is going to look a lot different than working, in family practice or something like that. So I do think, yeah, I think it's going to look different. The same way how I think the curriculum would look very different if I was in a different concentration. The requirements would look different, and the career and the job outlook would look different as well. So yeah.
Okay, that makes sense. And I think this is probably our last question, but, and I know you mentioned your personal journey throughout, but this question is, what advice would you give to someone who is thinking about pursuing a career in nursing, but they are not completely sure yet? And is there a specific experience that helped you decide that this is the career that you wanted to pursue?
Yeah, so I think if you're considering nursing but you're not totally sold on it yet, I would really like try to compare the healthcare career paths. Like, so if you're pre-health and you want to go into a healthcare field, I mean, aside from the shadowing part I talked about, I definitely did a lot of like Google searches and my own research as far as comparing like what a job looks like as a doctor, what does a job look like as a nurse practitioner, as a PA, which were all things that I at one point or the other was probably considering. What do those career paths look like? A lot of websites, like career websites, have really good like side by side comparisons of career paths, and they will break it down to you based on salary, the jobs that you can get, the experience that you have to have. They'll give you like these tables, and I would look at these tables and I'd be like, all right, well, I don't want to do that, or that doesn't sound good, but this sounds good, and kind of make like pros and cons in my mind when I was considering this career path. But yeah, I mean, my other biggest piece of advice is like, I mean, if you're unsure, there's nothing wrong with shadowing multiple different fields. Obviously, it's very difficult now during the pandemic. So during non-COVID times,
Mhm.
shadowing a doctor, shadowing like a physical therapist, whatever it is that you're interested in to get a better idea. And if you can't do those things now during COVID, set up phone calls with people or email professors, email doctors, nurses, and just talk to them. They probably have an actual a more interesting outlook on their career now, given everything going on, than they did before COVID. And so they might actually have a more interesting perspective to talk to you about. But as far as like a one point point in time that I can pinpoint as to why I chose nursing, I think I touched on it already. What it would be like the clinical interaction with my patients, and I was lucky that I was able to find a job in neurology, which is what I want to do. But I think that was sort of the turning point for me, was realizing, okay, I'm doing research, I'm working in research, but what I really like and what I think about at the end of the day and what I take away from my job is my patient interaction and my patient experiences. So yeah, I mean, that probably would be the biggest deciding factor in pursuing this career path.
Perfect. Thank you so much for participating here in our conference. Our students really enjoyed listening to your presentation and learning about what a career in nursing looks like and how to get there, basically. So thank you so much.
Thank you so much for having me. Thank you.
Thank you. And now we will transition to our next presentation.